Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Welcome to another episode of I Am You. If you're new to the podcast, welcome. Today, I have the honor to have Ms. Dexel here with us. Ms. Dexel, welcome.
Thank you.
I am so grateful for you to accept the invitation to come and join us in the podcast.
Of course.
I know that seeing such a young, beautiful woman sitting in this table means that you have a story to share with us about heart and your journey through a system. And when I invited you here is because, number one of the things that we tend to assume a lot in healthcare, particularly in cardiac world, is that heart disease is a disease of the elder. Mm-hmm. And I want for the audience, the women that are going to be joining us today, to understand that heart disease doesn't discriminate by age. Yep. And not only you are here to share your story, but also we have also some data about how women of color tend to be mostly ignored when they're presenting to the doctors and hospitals with symptoms, and they tend to suffer more from misdiagnosis and mistreatment. So why don't we start with how do you end up in a cardiology office?
Geez, where do I start? So I'll have to go back a few years. It was the end of 2021. And I remember I had like a really terrible day at work and my blood pressure spiked overnight. I didn't realize what was happening at the time. I got up, I went to the bathroom and I passed out. I went to the hospital. They had me in the hospital for several hours just trying to lower my blood pressure. They got my blood pressure normal. They sent me home. They're like, it's just high blood pressure. You're good. I'm like, okay. And I remember thinking, this doesn't make any sense. I can't just pass out. It's not normal. And I've started having like these chest pains on and off a little bit after that. And I went to my doctor. They sent me back home. They just adjusted my blood pressure medication, sent me home. And then a few months later, I had to travel to Florida, actually, came in for a family event. And I remember driving to the beach, just a normal day driving to the beach, didn't feel good, and actually threw up. I got nauseous, just randomly, couldn't understand what was happening, went to my doctor, got the same diagnosis, it's just high blood pressure, you're okay. I'm like, it's not okay, I don't feel okay. So I kept taking the blood pressure medication. I just went on living my life as normal for another 6 months or so, just trying to adjust my blood pressure medication as much as possible. And then I ended up in the hospital again because my blood pressure spiked. And I remember trying to explain to the doctor that I have these chest pains. I can't explain them. My blood pressure keeps spiking. What can we do? And I remember he was like super dismissive. He was like, no, you're fine. We'll just give you some more blood pressure medication.
How old were you? How old are you now?
So now I'm 46. So this started So 2021, go back 3 years, I was mid-40s. So now.
Okay. So you were only in your early 40s, and then, of course, they're seeing a young woman.
Right.
And is not only for their providers, is kind of like they don't want to think about a young woman having heart problem, but they don't even want to hear what you're saying. And, of course, it's unfortunate because the term of gaslighting in medicine, where a patient goes and said, this is how I've been feeling, and because it's not in their radar that even a young woman can be suffering from cardiac conditions. They said, oh, no, this is just this, and why don't you go home, take your pills, and you'll be okay. But this is a second visit to the emergency room for you.
Second visit.
Yes?
Oh, it gets better. So they gave me more medication for my blood pressure, and it wouldn't stabilize. It just kept going in and out. It would stabilize, then would go back up. Stabilize, then would go back up. And they had me talk to the cardiologist in the hospital. I won't mention the hospital at the time. And I remember trying to ask him questions, and he was super dismissive. He was like, no, you're fine. Like, we'll just, get you on more medication. send you back home.
You were trying to understand?
Trying to understand what was going on, trying to explain to him the symptoms that I'm having, and he just wasn't listening to me. So I actually checked myself out of the hospital because I was just so frustrated. I'm not getting any answers. They ran all the blood tests in the world and nothing heart-related. We should probably, I don't know, do more than blood tests. And I found another cardiologist in a different place. I won't say their name either. And I thought, okay, I'm going to get the answers that I want now because I'm having chest pain. So I decided to go find myself a cardiologist. And I thought everything was going good. He adjusted my medication. By this time, I'm on 3 medications in different variations. And I don't remember the name of the medication that he put me on at the time, but I remember taking it and I had like these really wild symptoms, headache, nausea. It wasn't working. My blood pressure was actually not stabilizing. And I called him and his response was, wait and see if your blood pressure goes up to 160 over like, I don't know, like 90. He's like, go to the emergency room.
One more time.
Okay, I guess I'll do that. So I did go to the emergency room, tried to stabilize it. Nothing was working. So I'm on multiple medications at this point. My blood pressure wasn't stable. I can remember like a stretch of like a month where my blood pressure was normal because I kept checking it at home and it was always high, still having these chest pains. And I kept telling them, I have chest pains. What can we do about it? Then I went to my primary care physician. She's like, maybe it's heartburn. So then she put me on heartburn medication. So
and at this point, you've been in the emergency room 3 times.
Yep.
The chest pain, at least you mentioned, in 2 occasions on those visits to the emergency room. Mm-hmm. And did anybody actually offer any evaluation for your heart besides blood work?
I must say the second cardiologist did order. I should back up. He did do EKG. And he did a couple of other things. I can't remember what they were. But
so there was some, at least, moment, there's some understanding, okay, so let's run some tests. But then once the test came back normal, then it's not your heart, just take your blood pressure medication and keep going.
And keep going, yep. And I just kept going. And I was so frustrated. And I kept telling my husband, I'm like, I cannot live like this. I can't just go through my days. On top of the chest pains, I was fatigued all the time, just tired. I would get 8 hours plus of sleep, just tired all day, every day. And he actually found you.
He was the one who found me.
He was the one who found your office, yeah. He's like, hey, I found the cardiologist that you should try. Just try something else. And that's how I ended up in your office.
And why though he has to, okay, so 2 things that I wanted to use in here. So your husband worried about you. He heard you.
Yep.
And then he was searching for somebody that could offer you something different than what you've been experienced, that you have experienced with the other providers. But also, when he used the term, I think you should try. It's just because you were getting to the point that it's like, what are they going to do for me?
Right.
Like, I've been in the hospital 3 times. I've seen 2 cardiologists. They keep saying it's nothing. And so was that where you are? I don't want to assume.
Yeah, no, I was at the point where I'm like, all right, I'm like, fine, I guess I'll go. At this point, I think when I got to you, I was still on 3 medications. I can't remember. 3 medications plus my heartburn medication because apparently that's an issue as well. And I was like, all right, I'll just go. I'm like, what's the worst that could happen? I'll just have another conversation, run more tests, and go through this mode of thinking I'm the crazy one because I wasn't getting answers. And I started to doubt myself. I'm like, maybe it's not my heart. Like, maybe it's just one of those things where I'm like, I started rationalizing I have a very stressful job. That's probably it. I just need to reduce my stress. Tried working out. I mean, I do work out. Chest pains never go away.
So you were getting to that point where you're like, it's probably on my head, which is
absolutely.
which is actually the point where the reason why we do this type of podcast and you are actually sharing your story with the women that are listening is so they don't get there, because once you get there, that can cost you your life. Yeah. So we said, once you get to the point that you're like, well, perhaps this is me. This is in my head. So then if you are listening to this podcast and at any point you have felt like this is probably on my head, listen to this woman saying, I was getting that close before I found the answer to my problem. So you came and see me.
Yes.
And what happened?
And I guess I remember the very first visit, and I went home and I told my husband, I was like, first of all, this is the first doctor who actually sat down with me for more than 5 minutes answered my questions, listening to what I was saying. And I remember the first thing you said to me when I told you I was on all these medications. You're like, that doesn't make any sense. You're too young to be on this many medications. And the first thing you did was adjusted my blood pressure medication to take me down to 1, which miraculously my blood pressure has been stable since then. And then we started monitoring my symptoms. Each visit we would talk about what's happening and talk about how we would go step by step to assess what are my symptoms, how am I feeling, let's get these tests. And I remember I called and said, hey, I don't know, like these symptoms are just not, I don't like it. And that's when, I think by this time we're into this year, 2025, and you recommended that I just do all the tests again, just like do all the heart-related tests and take our time and make sure that we really do like a thorough assessment and...
Okay, I'm going to stop you there for a second. So when you came to me and I saw your med list and your blood pressure was still not controlled,
it's not.
That is actually a red flag where we said, why this patient so young and so many medications and the blood pressure is still not responding? And I want the women that are listening to us that the reason why I went through that thought process is because whenever we see that type of problem where we have 3, 4, 5 medications and the patient is still hypertensive, we got to start thinking there's a secondary cause of this high blood pressure, no? So you were going doctor after doctor, ER visit after ER visit. They probably were even imagining that you're not taking your medications. So they adjusted the dose and then they add another pill and then they add another pill and then they adjust the dose. And then when they maximize that one, they get another pill. And then when do we stop and said, wait a second, maybe she has a secondary cause for her hypertension. And that's actually when we went through the workup, that's what we found. You have a secondary cause of hypertension. The reason why one pill worked, because we found the cause of your hypertension, no?
Yep.
And so we control that, and then you have all this testing that were done on you. So we said, okay, so we rely, which is another situation, which is you had this test, I'm reading reports, all the report says everything related to the heart seems okay, but then your chest pain reoccur, and I said, okay, let's go through this process one more time. Let me see if I can find something that I can help you with. And then we found that you have an abnormal test, which I recommended that you do a more invasive testing, which is where I take you to the cath lab to try to understand why your chest pain. In this case, it's your chest pain. The original test show us there is a concern for lack of blood flow to the heart. You are 46 years young, which not a lot of 46 years young go through coronary angiogram, but it's something that we have to think about it. Not only because you're 46 and we are already going through perimenopause. Yes. We got to think about that. No.
Yeah.
So although you're 46 is that time where we are going through the transition, and we had to know that hormone changes is the number one cause for coronary artery disease in women, for heart disease in general. So we cannot ignore the fact that women have their unique risk factors, and that in this case, perhaps changes in estrogen is actually playing a role in you. And when we did the test, we discovered that, yes, you don't have blockages, but you do have another condition for which women suffer more frequent, which is microvascular disease. And then in your case, we give it a name. Now you have a name for your condition.
Finally, right?
So then it's like you have ANOCA, which means angina with non-obstructive coronary artery. Yes. So the chest pains, in this case, we were blessed. You were blessed that you had chest pain. No chest pain, you will think about the heart. Many women will never have chest pain. But in this case, your chest pain was a real deal. It wasn't in your head. It was not because you were stressed, although stress can trigger chest pain. But we found there is a problem. It's real. The arteries are not relaxing. We started you on medication, and you came to the office, and you are feeling how?
Like you changed my life.
And that is because now you're not feeling like if I had to deal with this fatigue and feeling like this the rest of my life, then I will deal with it. Now seeing you when you came in, and that's actually what I'm like, you need to come, you need to share this story. Because when you come, and of course you saw my nurse practitioner first, and they come and I said, oh my gosh, she's feeling so great. She feels much better after we give you the diagnosis and the treatment. And then, it's such a It's such a beautiful thing for us as provider when we can actually navigate through a system and find what is it that you have and then treat you. But it's the awareness of the condition that made me powerful to find it and treat it. If you don't know that this can exist, then you cannot go the right path, nor will you receive the proper treatment. So, like you, there's a lot of women out there that have visited more than one cardiologist, that are feeling defeated, that they are already believing that this is on their heart, and your story should be a story of empowerment. That you just need to find the right provider.
Yeah, they do. I mean, for me, my life has literally changed. I went from like, oh my God, I'm so tired. Like, and my husband said this to me a couple of days ago. He's like, you haven't said you're tired in a long time. I'm like, yeah, because I'm not. Actually, wake up and go through my days without feeling as if I'm just forcing like every step, every moment of just like, all right, I just have to function, get through the day, and that's gone. I'm no longer fatigued. I do my morning workout. I go about my day. I go to work, and I'm like, no chest pains, no fatigue. Look at that.
So now tiredness is not going to be a lifestyle for you.
It's not.
You can be tired one day, but that's going to be like an exception. So that maybe if you say I'm tired again, your husband will probably be like, what did you just say?
I know, like legitimately. I just assumed it was because I kept saying, well, I'm older and I have like an 8-year-old that I'm chasing around.
I'm older at 40.
I know. I rationalized everything in my head. I'm like,
Typical of women though.
Yeah.
Typical of women, no? So we tend to justify why we feel the way we feel. Why? It's because I have an 8-year-old and I have this work that is very demanding. But, and that's actually is the point of having you here today. So we have very powerful women out there listening, executive, mothers, teachers, listen to Sophia's stories. It's like, this is the point where you said, I'm not going to settle. And then your life will change like that just when you find the right person.
Absolutely.
So we are going to invite our audience to continue to be the CEO of their health, to keep advocating for their health. Yes. And in your case, we're going to kudos to that hubby, that amazing husband that said, we fantastic. Are not going to settle for this. So it takes a village, no? And in this case, it's like it was a he for she, and he wanted to make sure that his wife was going to be okay.
Yeah, no, it's fantastic. Like he advocated for me so much, even in the hospitals when the doctors were saying one thing, he kept asking, and we weren't getting the answer. So, and I think he showed up. He might have showed up on my first appointment with you. I'm pretty sure he did.
Yeah. Remember that when you came in by yourself for your last follow-up appointment, I said, "Oh, you must be feeling good because there's no husband in here today." So, I want to thank you one more time for giving us the privilege to share your story with the world. Yeah. And I want to invite our perimenopausal women to listen to their bodies. And when they feel that something is not right, just find the right provider that understands your problem and seek medical attention. Yes?
Yes.
And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.